Hey, we're back with Dina Cabrera. She's a clinical psychologist here at Remuda Ranch. And I want to talk with you and have you share about your anxiety program. You know, anxiety goes hand in hand with eating disorders, yes, but you can also have anxiety without eating disorders. So tell us how you guys are treating anxiety as a separate kind of a thing here.
Well, I think you're right, because after 20 years we have treated eating disorders, and the comorbidity or the association with anxiety is quite high. I see or have experienced that most of my patients with eating disorders have experienced anxiety, particularly obsessive compulsive disorder. And so those obsessions and compulsions can be so debilitating and cause extreme dysfunction, low self-esteem in someone's life, that it does warrant an inpatient treatment because their lives are so out of control, or they're isolated, or they just can't function.
So what are some of the things that are maybe unique to anxiety treatment that would be different from what you would do with an eating disorder?
Well, with anxiety, particularly OCD or obsessive compulsive disorder, we spend hours upon hours actually exposing the person to fear.
To what they're afraid of.
To what they're afraid of,
because
life is full of fear, stress, and worry, and we want to tend to hide from it or avoid it, and that's only perpetuated the disorder even further. So what we want to do is spend the time that is needed so that we expose them to the fear without letting them do their compulsions or their behaviors to help them reduce the fear. We want them to actually get used to it, be exposed to it, and so eventually that fear, that worry, immobilization of being able to not move or do anything subsides. And eventually they will be able to tolerate those things that make them afraid in the first place.
Well, two things. First, what are some coping mechanisms in addition to eating disorders for anxiety? And then the second thing I want to talk about is, how does a person know if their anxiety is significant enough to warrant treatment?
Well, oftentimes what's happening, that I see patients coming in to get the help for their anxiety disorder, OCD particularly, is that it takes a number of hours with a skilled therapist to actually make progress with their OCD. And so oftentimes, because of insurance reasons or just time with a therapist, they're not able to pay a therapist, or a therapist doesn't have time to do the time that's needed to do the work that's possible. So real progress can be made in an inpatient treatment center where they can spend hours upon hours. So we do it 4 to 5 times a week, where we expose that person, and within that time period of inpatient treatment, 60 days, or 45 days, we make significant progress with their OCD. And so that alone is worth, getting, a year worth of therapy in 60 days.
How do they know if it's significant enough for them? What would be some signs that my anxiety is life-controlling?
Well, again, they're debilitated. They can't function. They can't go to work. Their social relationships are ruined or non-existent. And they keep perpetuating the cycle. I see oftentimes patients coming in who are on the verge of divorce, or they've broken up again with another person because they can't function with their OCD in real life situations. And so that definitely is a sign that you need to get higher level of care for your treatment. Also, another sign is that outpatient treatment isn't working. It just simply isn't working, or it's just not enough to get the care or get the progress that they really yearning or needing for treatment. So inpatient care may be warranted at that point.
Okay, cool. So if you recognize that you struggle with anxiety, and I would think things like you can't sleep well, you have difficulty connecting with others, you find yourself consumed with fear. If you recognize anxiety as an issue in your life, there are treatment options available, and Remuda has a good, solid program that you can look into. Of course, for more information, you can go to your website, which is remudaranch.com. You can see it there on your screen. And thanks again for your time and for all you've done with us.
Very good. Thank you.
Bye-bye.